You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode, I talked to Dr. Carly Turner-Garcia about OPU and ICSI. The Disease Du Jour podcast is brought to you by Merck Animal Health. Dr. Carly Turner-Garcia is currently the head veterinarian at the Lazy E Ranch in Guthrie, Oklahoma. She is board certified in theriogenology. Her areas of specific interest are advanced equine reproduction and equine neonatology. She graduated veterinary school from the University of Georgia, completed an internship at Roden Riddle, Kentucky, and a residency at Texas A&M University. She has a passion for horses and teaching people about them. She and her husband also own Top Cat Genetics, where they raise cattle, registered boar goats, and train and trial working American Border Collies. Thank you, Dr. Turner-Garcia, for joining us.
Hi, it's a pleasure to be here.
Yes, so can you get us started by explaining what exactly OPU and ICSI are and how these processes work?
Yeah, absolutely. So OPU is an acronym that stands for ovum pickup. Also, we call it TVA, which stands for transvaginal aspiration. And it's a technique that we use to harvest eggs or oocytes, if you want the doctor word, from the ovary of an animal. In this particular situation, horses, but it can be done on other species as well, like cattle. So we go in, we take the eggs straight from the ovaries, and we send them to a lab for fertilization. And we call those in vitro fertilization, or IVF. Do it in humans as well. Where ICSI comes into play is we're not really very successful with the actual IVF technique yet, where you just put the eggs and the sperm in a dish and the magic happens. So what we have to do in horses is called ICSI, and that ICSI, it stands for Intracytoplasmic Sperm Injection. And that's basically the fancy term for us taking a single sperm and actually injecting it into a single egg or oocyte and fertilizing that oocyte in the lab. So that's what OPU and ICSI stand for.
So what are some advantages of these procedures compared to other procedures such as embryo transfer?
So there's a lot of advantages, some disadvantages, but a lot of advantages as well. So if you have, we'll start on the mare side first. So the advantages of this are if you have a mare that's had uterine problems, she's allergic to semen, she pools fluid, has chronic endometritis, whether it's fungal, bacterial, things like that. Any reason that would make it difficult to flush an embryo or carry a pregnancy, adhesions, cervical problems, you can bypass all of that with OPU and ICSI. You can go straight to the ovaries, take the eggs from there, so you don't have to worry about the sperm getting to where it needs to be, and then the mare producing a good egg, and then fertilization happening, and then that embryo making it into the uterus, and then it growing appropriately and you getting it out of the uterus. You know, we're so successful at it that it sounds easy, but really there's still a lot that goes into embryo flushing and making a pregnancy. So that would be one of your first ones, is that on a tough mare, it can improve your odds. A lot of people now are using it on their show mares, because instead of bringing them in, waiting till they come into heat, breeding, waiting for the embryo flush, if they have enough follicles, you can just bring the mare in, have the OPU or TVA done, and then she can leave the same day if everything goes well. And so it's kind of a one-stop shop. And for the most part, if your person that's performing the OPU is pretty skilled, they really don't have very much soreness or side effects at all from that. And so usually I just say, hey, give them 24 hours off. You can go back to showing, working, whatever you'd like to do there. So it's a pretty good procedure that way. There's a lot of other kind of options to do it as well. So you're more likely to get multiple embryos if you do ICSI versus embryo flushing, because we're not great at super ovulating mares. But, you know, all of this on the mare side depends on, you know, how many follicles the mare grows. The more follicles you have, the more oocytes or eggs you're going to get, and the more likely you are going to be successful. Things have come a long way in the last 15 years of us doing OPU, but more numbers usually still equals a little bit more success on these mares. Now, on the stallion side of things, you know, there's some stallions that are either really subfertile, it's very difficult to get mares pregnant, or some stallions that there is a very limited amount of frozen semen on, whether they were castrated and, you know, it's limited, whether they are deceased or anything like that. The semen was lost. for whatever reason, you can oftentimes use, the way I like to say it is, we use a traditional 8-straw frozen semen dose to breed. Well, you can do 240 breedings with that, essentially, if you were unlucky with ICSI. So if you're unlucky, you could maybe get 240 breedings out of that with ICSI. So you can stretch Stallion's genetics and his lineage a lot longer using him for ICSI than you could breeding traditionally. And then your subfertile stallions that it's just tough to get pregnancies on, again, a lot of people will choose to go straight to ICSI instead of, taking the money to breed 3 or 4 times until you're successful.
Today's Disease Du Jour podcast is brought to you by Merck Animal Health. Merck Animal Health believes that if we all do right by the horse, we'll never do wrong. That's why they're driven by an unconditional commitment to the horse and to the veterinarians and communities who support them. From infectious disease tracking through the Equine Respiratory Biosurveillance Program, to building a sustainable profession through the Veterinary Wellbeing Study, to creating equine health products with the highest level of safety and efficacy, Merck Animal Health is unconditional. It's just who they are. Learn more at merckanimalhealthusa.com. What types of males are ideal candidates for OPU, and is there an upper age limit at which it's no longer effective?
Like we kind of touched on before, fertility is fertility. So your most fertile mares are going to be your sexually mature younger mares. So anywhere from the age of 4 up until the age of about 13. And 13 is when mares start to have an increased amount of chromosomal abnormalities in their oocytes or eggs. And so your odds of success with anything, whether it be breeding to carry, flushing, or ICSI, are going to start to trend down. Now, every mare is not created equally. Some mares start to, trend down at 13. Some mares you're doing OPU at 18, 19 years old, and they're still champions. They're doing great. So it is very mare dependent. And I will say that, just because you weren't successful the first time on a mare doesn't mean you won't be successful the next time. So that being said, your older mares that are above 20s, usually they're not going to have a lot of follicles. You're going to have less opportunities to be successful, and their oocytes are going to be lower quality and have more abnormalities. So you can still get it done. I've seen embryos made on 26-year-old mares, but in general, it's going to take a little bit more time, a little bit more financial investment, and some pretty fertile stallions to get success on your pretty older mares that are in their mid-20s and so on. But your younger mares too, I see people that bring in 1-2-year-old mares that they would like this done on. And you just have to remember that even though they're super young, they're not sexually mature yet. So you can run into some of the same issues on very, very young mares that you run into on very, very old mares as well. And then you're going to have some mares that are just champions and they're going to do great every single year. And some mares are just going to be tough every single year. So, but your ideal candidates are going to be your younger mares and when they grow a lot of follicles. And so even if you check your mare once and she doesn't look like a great candidate for OPU at that time, that doesn't mean she won't be again. And I have a lot of mares that during the breeding season, we push them to cycle out of their natural season. And then by the time we get to their normal season, we've already worked on them a lot reproductively. And so I see a lot of mares that are actually successful for this, in the fall when they're kind of transitioning out. And so it's a good thing to remember that you don't have to just do it during breeding season. You can do it during the off season and actually have more success. You can freeze or vitrify your embryos then and then transfer them at your leisure. So.
Do you have any experience performing the procedure on deceased mares? Is this something that's viable and worth the investment if someone loses their mare unexpectedly?
Yes, there's a lot of factors that go into it. Most of the time, if you can plan ahead a little bit, like your mare's not doing well, or that she's going to have to be put down, the most successful we are is when you can kind of put the mare under anesthesia and take the ovaries prior to euthanasia. So if you can plan a little bit, it's a really sad scenario and usually a tragedy, but oftentimes to have a baby out of that is kind of full circle, right? But you can, absolutely. So, and even if you can't plan ahead, we've still had cases that have been successful when horses have died. And, maybe like 2 hours after the horse died, they said, oh, shoot, I didn't even think about that. Can we try it? Yes, you can. Facts are facts. And so the longer the horse has been deceased, the less likely you are to be successful. In general, if you can get the ovaries or oocytes to a lab within 6 hours and take those oocytes and put them in the culture media, you're a lot more successful. Kind of 12 hours later, your odds of success start to go down. And then after that, they significantly drop off. But, I've had some crazy stories. I had one mare that had a traumatic incident, and then she came in and she wasn't going to make it. And so we did that. We put her under anesthesia. We took her ovaries. It was in December. She had been showing, she'd been on Regimate, and she only had one follicle. We got one egg oocyte out of there. It did mature. We did ICSI it, and then I fold out her recipient mare and that baby the next year. So that's one of my favorite stories. It doesn't always go like that, but that's one of my favorite stories. And if people want to put the financial investment into it, that's the story I tell them about. Hey, you know what? There's always a chance. So you can definitely do that. Just keep in mind, the sooner you get those to a lab or someone who can take the oocytes out, the better. And I've also heard crazy stories. Some of my colleagues had a mare that had been passed away for over 24 hours, and it was cold outside. And then the client asked, and so they took the ovaries 24 hours later, and they actually did successfully get embryos as well. Now that's, I would say, a very rare occurrence. But again, crazy things happen in equine medicine and equine reproduction all the time. And the only other point to that note is, if your mare's been really, really sick, really painful, had a lot of medications, it does decrease your chance of success because those things do affect oocyte quality. Now, can you still be successful? Yes, but it's just one thing that I like for them to take into account before they put the financial investment into that. So.
Yeah, those are two amazing stories. I guess on the topic of oocyte quantity, how many do you hope to recover in a successful procedure in a healthy mare? And how often is the procedure successful in acquiring any?
Yeah, absolutely. So I actually have some really good numbers for you there. It's an honor for me to be a part of ICSI Lab that's here local to the Lazy E Ranch called Reliance In Vitro. And so I not only have our numbers, but I also have our sister labs numbers who've done over 7,000 ICSI pregnancies and over 15,000 ICSI embryos. So it depends on the mare and how you set them up. So for example, in Brazil, they travel to the farm. They do all the mares that the clients want to have OPU done that day. And so your average oocytes that you're going to recover are going to be somewhere between 6 to 10 oocytes. But just because you do the mares as they're there, not as they're being followed and checked. For me, working at the Lazy E Ranch, a lot of my mares live with me for the full season or year round. And what I can do is I can check them and say, hey, you know what? She doesn't have a lot of follicles today. Maybe let's short cycle her, see if she'll bring up another follicular wave, and we'll do her when she looks better. And so being able to manipulate the cycle and kind of schedule the mares when they're best has allowed me to get more of around the average of oocytes per OPU. And now some mares are old, you're going to get 2. Some mares are crazy. I've gotten like 53 oocytes on a mare before. We made 17 or 18 embryos that time. But for the most part, you're going to get somewhere between 10 to 15. And so if you get more than that, that's great. And if you don't, there's still a chance. As far as our ICSI lab with Reliance In Vitro, we successfully make embryos about 94% of the time. And so it's going to be lab dependent a little bit there. Not all labs are the same. Not all embryologists are the same. But And if you'd asked me this like 10 years ago, I would have been like, man, less than a 50% chance on the first time that you're going to be successful getting an embryo. But it has come so far in the last 10 years that I would say most of our clients do get embryos on the first try. Now, whether those embryos go on and make a pregnancy, that's a whole different ball game. Pregnancy rates are somewhere between 50 to 70%, and then actual foaling rates are a bit lower than that. Depending on the lab, depending on the facility that transfers the embryo, they're anywhere from like 30 to 50%. So,
and I assume that 93 or 94% is chance of making one embryo out of all the oocytes harvested. Do you know the percentage of mature oocytes that you expect to fertilize successfully? And if you have extra embryos, can you freeze those and use them in later years?
Great questions. So our lab right now, we have about a 70% maturation rate. So 70% of the oocytes or eggs that are sent are going to mature to undergo ICSI. The other ones, at any point in time when you take eggs from a mare, some are kind of on their way up and some are already dying off. And if you get the ones that are already starting to die, so far I haven't met anybody since Jesus Christ that's faithfully resurrected something. So we can't bring those back is what I'm trying to say. And so those those are going to die no matter what you do. And so we get about a 70% maturation rate. And then out of that 70%, we have about an 85 to 90% cleavage rate. So most of the ones that we inject start the embryo process, and that's what cleavage means. So when you guys are doing ICSI and you're getting your update, this is how many have cleaved. It just means out of the ones that were fertilized, those are the ones that have started the embryo process. And if they don't start the embryo process, they never are. So that's the total number of embryos that you could get. And then as far as our embryos that are made from the ones that we've ICSI'd, we're at about 50 to 60% right now. And then for total oocytes, so let's say you aspirated, 10 oocytes on a mare, we're at about a 30% blastocyst or embryo rate on those. So you'd be like 3 embryos per 10 oocytes aspirated, even if you didn't fertilize all of those. And so our average number of embryos on a mare right now is 4 embryos per OPU session. And that's not for everybody. Some people get 14 and some people get 1 or 0, but I feel like it's getting pretty rare to get 0. And then of course you can vitrify all of them. Sorry, vitrify means freeze. We do it a little bit differently. We kind of turn them into a glass-like state. It's a little bit safer. Makes them a little bit more successful when we warm or thaw them to transfer. So that's why I say vitrify. But you can vitrify as many as you want. If you have a recip facility that'll transfer 2 or 3, you can transfer 2 or 3. But, equine reproduction's been so popular recently, it's kind of hard to find a lot of recips. And so sometimes you're lucky if you can get one good one to put 1 embryo in. And so we'll often transfer the first embryo that you get and then freeze any of the subsequent embryos. And if that first one doesn't work, you can transfer another one that year. Or if it's kind of late or the breeding season's over, you can wait till the following year to transfer. But, just with everything, you got to make sure all your paperwork's in line and that you still have a good breeding to that stallion and so on and so forth. We can't just think that because we had 5 embryos, we get to transfer 1 embryo a year for the next 5 years. It's not how it works. And then some stallion owners will require payment at time of transfer, but I would say that the majority of the ones that we work with, once you get a 35 to 45-day successful pregnancy, if you transferred a frozen embryo, that's when they're going to require payment on the stud fee.
What are some of the risks associated with OPU?
So that's interesting because there's kind of an ethical debate going on right now, especially in Europe. And I've even seen it among colleagues here in the United States, whether OPU is ethical in horses due to side effects and things that can happen. And so I can tell you from my personal experience and from a lot of the people that I've worked with, I've been doing this for a little over 7 years pretty heavily now. And it is extremely rare that we even see anything happen with these mares, But I do think it largely depends on the experience and skill set of the person that is driving the needle. So to be a little bit graphic, what we do is we actually have an ultrasound that goes in the vagina, and then we stick a pretty big needle. I wouldn't want to be stuck with it. Into the abdomen, into the ovary, okay? And so there's blood vessels there's rectum, there's organs, there's things like that. And so there's a chance that things could go wrong anytime you do this procedure. You need to make sure your mare is sedated appropriately, that she's got good pain meds on board, plus or minus antibiotics, depending on the skill set of your OPU person and that sort of thing. So for me, it's extremely rare that we have any side effects. The ones that I've had in 7 years is I've had some mares get a little crampy, but they're also the ones that you can 100% tell when they're in heat. They're painful when they're in heat. Their ovaries are just very, very sensitive. And usually, within 6 to 12 hours, honestly, they look really good. It's extremely rare that it goes on longer than that. And I would say that it's maybe 1 or 2 mares a year out of the few hundred that we do. I can't think of a single one this year that's been uncomfortable after the procedure. Other side effects that you can have, obviously, the vagina is not a sterile environment, and you are transferring a needle from the vagina into the abdomen, which is a sterile environment, to the ovary. There is a possible risk of contamination there, especially if you have a mare that's like really dirty or something, we do try to clean them up a little bit before we do the procedure. If we're doing the procedure because she's a chronic endometritis mare, we try to, get the vagina cleaned up a little bit, be as clean as possible. But there always is a small risk there. Back early in my career, I did see a mare on referral that had an ovarian abscess, but she's really the only one I've seen like that. And the technician that was doing the OPU was rather new at it then. So I think perhaps that had something to do with it. But the most often thing that we see is a little tiny bit of blood on the sleeve, not even a tear. It's more like just a little rub on the rectum because you are holding the ovary through the rectum. I have heard of people tearing rectums. There's a bunch of other things that can happen, but I don't want to go too in depth with it because, I can say a lot of scary things about the things that could happen, but really, you go into the rectum to flush an embryo too. And I would say I've seen more tears with flushing embryos than I have with OPU procedures. So overall, I think it's actually a pretty safe procedure, especially if you have someone do it that pretty skilled and has had a lot of practice. So, and like I said, as far as the ethical debate, I don't know. I don't want to touch on that too much, but for me, I think it's a pretty safe, pretty straightforward, and a pretty quick procedure. Some of these horses don't do well in stalls. They don't do well in herds with other mares, and keeping them here for 2 or 3 weeks for other things might not be the best thing for them. So it's just nice with anything, to have an alternate option for those mares so that we can be successful, right? Because success doesn't look the same for every single mare. And so more options, I think, is better, especially if you're taking into consideration the health and overall well-being of the mare. And I can tell you that nobody cares more than I or my staff about how these horses do and how successful we are for our clients as well.
Yeah, it's a great point. And there's obviously a lot of risk with any sort of breeding you do with horses. So I imagine it doesn't even compare to a mare actually filling out her own pregnancy.
Fair point. Yes. I would say we run into more problems with mares actually foaling than we do with OPU. So that's a great way to look at it.
So what type of facility would be required to perform either of these procedures? Can you perform OPU on the farm, or would the mare always need to be hospitalized for that?
So we have a bunch of different options. So for our lab, Reliance In Vitro, we actually have a wonderful licensed veterinarian, Dr. Rocha, who goes to facilities to perform OPU. And if you would prefer to have it done, you can somewhere else. You can always send your mare into a ranch like the Lazy E, or there's a bunch of other places that do OPU as well. You definitely don't have to go to a referral hospital. In fact, I would say most referral hospitals probably don't have a lot of people doing OPU outside of universities. A lot of your big reproduction centers will have someone that either comes regularly to do it or have a vet on staff like me that offers the procedure. And pretty much what you need to do it is to have a area where you can appropriately restrain the mare. I personally prefer a set of well-built stocks. And then you need to have access to drugs that obviously you require a veterinary license to use for the mare. And then we like to have a clean area to be able to select and search for the oocytes or eggs. So it can often be hard in a dusty barn to have a clean area like that. And you don't have to have like a hood that you would see in a research laboratory or anything like that. We just have a separate room that we keep clean, that we wipe down every day before we select the oocytes. You just want to be able to clean it and kind of keep it clean. You don't want to be in the middle of a dust bowl while you're looking for the eggs. So if you can provide those two things, a solid set of stocks where the mare can be restrained appropriately, then whoever comes out and does it or whoever's doing it should have all of their equipment to travel with them, and you don't really need anything else.
Great. Well, do you have anything else you want to add on the topic of OPU or ICSI before we wrap up?
I don't think so. IVF is starting to be thrown around quite a bit, and it's not really to a stage where we can use it commercially. And even if we do get to commercial IVF, I do think that there will still be a spot for ICSI in the future, because IVF will require a lot more semen, and it'll have to be really a lot better quality for fertile semen to get that done. So I think for subfertile semen or limited semen, ICSI is still always going to be something that we can use, as with humans, right? That you can do IVF with humans, but they still prefer to do a lot of ICSI with humans as well. And so I think another hot topic lately has been the monozygotic twins, because that can happen where you have a single embryo that you transfer, and then all of a sudden at heartbeat check, there's 2 babies in there. And a lot of times they share blood supply. So we're not as successful reducing one pregnancy oftentimes they both die. And so that's something that's being worked on a lot right now. But at the end of the day, it really looks like that rate of monozygotic twinning is kind of 1% to 2%. But it is something that I like clients to be aware of when we go through the process, because oftentimes, you've put a lot of financial commitment, there's a reason that we've had to do ICSI on the mare, whether it's a high value stallion or the mare hasn't been successful otherwise. And so people say, oh, I got a pregnancy, I'm so excited. And then all of a sudden there's twins and we're talking about terminating and so on and so forth. So I think it's a great thing to make sure that we, as far as veterinarians go, are doing a good job educating our clients on everything, including that topic, so that they know what they're getting into and know what kind of plans we're going to need to make going along with the mare.
Thank you so much, Dr. Turner-Garcia, for joining us, and thank you to our audience for listening, and a very special thank you to our sponsor, Merck Animal Health. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com. That's CSISSON@equinenetwork.com.